Medicaid could be slashed by over $1 trillion. 12 plus million people may lose health insurance by 2034. SNAP cuts could deepen hunger and poverty for millions. Environmental protections are being rolled back in frontline communities. All while the bill touted as a tax break and spending fix is projected to add 3.3 trillion to the national debt. This is the biggest rollback of health access in US history, and most people don't even know it's happening. Hey friends, I'm Omari Richins, founder and CEO of the Public Health Millennial, where we help you learn, navigate, and transform your public health journey. If you'd like to support the platform, be sure to hit that subscribe button and check out our resources below. The bill with a beautiful name and ugly consequences. A massive bill has made its way through Congress, marketed as a bold simplification of government spending and reform, officially known by many as the One Big Beautiful Bill. It promises efficiency and savings, but underneath the shiny branding lies a harsh reality. It guts the very systems that keep people healthy, housed, fed, and thriving, especially low income Americans. And despite its branding, it's projected to add 3.3 trillion to the national debt. This bill could fundamentally reshape public health in the US and not for the better. Health is more than healthcare. As a public health professional, we know healthcare alone accounts for just 10 to 20% of health outcomes. The rest, it's the food we eat, the air we breathe, the jobs we hold, the stress that we carry, and the systems that either support us or neglect us. The One Big Beautiful Bill slashes support at all levels, cutting Medicaid, SNAP, which is food assistance, environmental protections, Affordable Care Act coverage, community clinics, and rural hospitals. Public health was already under strain. This bill pushes it to the brink. Medicaid cuts and health access. With over $1 trillion in cuts, the One Big Beautiful Bill brings the largest Medicaid rollback in US history. These aren't just budget lines, they're people's lives. These aren't abstract numbers. They translate into fewer people with coverage, fewer hospitals staying open, and more people going without care. Here's what's changing. 1. Millions may lose coverage due to new work requirements. In 40 plus states, Medicaid enrollees must now prove 80 hours per month of work, school, or volunteering, or risk losing coverage. Most already meet these thresholds, but administrative red tape will push people out anyway. 2. More out of pocket costs will push people to delay care. States can now charge up to $35 per visit for low income patients, enough to make many skip needed appointments and worsen long term outcomes. 38% of Americans delay care due to high cost. 3. Rural and safety net hospitals will suffer. Medicaid helps keep these facilities open. Without it, many may cut services or shut down entirely, leaving entire communities without local healthcare access. And 4, essential services will be lost. From maternal health to mental health and long term care, Medicaid covers what private insurance often doesn't. Cutting it means abandoning those already most at risk. This isn't just about saving money, it's about dismantling a core piece of our public health and health infrastructure. In fact, states that expanded Medicaid, hospitals saw dramatic drops in uncompensated care and improved financial stability. SNAP reductions. As if cutting healthcare wasn't enough, the bill also takes food off the table, literally. It reverses SNAP protections for veterans, foster youth, and unhoused people, adds stricter work requirements estimated to cut 2 plus million people from benefits, slashes 186 billion from nutrition programs over 10 years. For every meal food banks provide, SNAP provides 9. One study suggests these cuts could cause 93,000 premature deaths by 2039. SNAP isn't just a food program, it's a life-saving intervention. Environmental rollbacks in community health. While gutting safety net programs, the bill expands tax breaks for oil and gas, fast tracks dirty energy projects, and weakens environmental oversight. Who suffers? The same frontline communities already burdened by pollution, unsafe water, and disinvestment. Even worse, the bill proposes letting developers pay to bypass environmental review and judicial oversight, silencing the voices of the most impacted communities. Hospitals will close, communities will suffer. Hospitals rely on Medicaid to stay open, especially in rural and underserved areas. This bill slashes that support. A study from UNC found that 300 plus rural hospitals may be forced to cut services or shut down entirely. In some places, the nearest hospital could be soon 90 minutes away. The bill also shortens the Affordable Care Act's open enrollment period, makes re enrollment harder and more bureaucratic, cuts subsidies that make coverage affordable, and defunds Planned Parenthood, even for STI testing, cancer screenings, and prenatal care. Health is political, and this bill proves that public health can be a casualty of partisan policy. Higher education cuts, slamming the door on opportunity. The One Big Beautiful Bill doesn't stop at healthcare and food assistance. It also delivers one of the most damaging blows to higher education in recent history. For millions of students, particularly those from low income and marginalized backgrounds, this bill threatens to turn college from a pathway into a dead end. Pell Grants slashed by up to 23%, with new rules requiring 15 credits per semester, which can be a barrier for working, caregiving, community college students, or part time students, and disproportionately affects these types of students. Subsidized loans eliminated, making college less affordable and forcing students into higher interest debt. Graduate loan caps imposed, affecting future public health, medical, and other health related professionals, cuts to federal research funding, stalling innovation and student job opportunities. These cuts hit hardest for the very students public health needs more of. Education equity is health equity. Why you should care about Medicaid cuts, even if you're not on it. It's easy to assume Medicaid cuts only affect other people. The truth, everyone's health system and wallet takes a hit when Medicaid is underfunded. Uninsured people still need care. When they show up at the hospitals or emergency rooms and can't pay, those costs don't disappear. Hospitals and providers absorb them as uncompensated care. And who pays for that? You do. We do. The costs are often passed on through higher premiums and medical bills for those with private insurance. According to the Kaiser Family Foundation, states that expanded Medicaid saw significant reductions in uncompensated hospital care, easing financial strain on hospitals and lowering costs systems wide. Fewer Medicaid dollars means more strain on hospitals, especially safety net and rural ones, pushing many towards closure. Even if you don't have Medicaid, your local hospital may not survive these cuts. Medicaid also helps cover costs for things private insurance often overlooks, like long term care, behavioral health, maternal health services. Losing this support increases public health crises we all end up paying for. When Medicaid is gutted, everyone feels the consequences. Even if you're not on it, we all pay the price financial, physical, and socially. Public health at a tipping point. There's precedent for this moment. In the 1960s, Medicaid and Medicare were created during a time of major social change, helping cut poverty and racial disparities in care. We're at another tipping point now, but this time, the federal government is threatening to reverse that progress. We can't afford to be quiet. Not now. We must stay active. We must stay loud. A call to action. What can we do? The One Big Beautiful Bill has passed. Marketed as a fix for federal spending, is projected to add 3.3 trillion to the national debt, while slashing Medicaid, SNAP, environmental protections, and support for students. Even with Republican opposition and a record breaking speech from Minority Leader Hakeem Jeffries, the bill moved forward. But public health doesn't end with Congress. Here's how we can keep going. 1. Act local. Support grassroots organizations working on food justice, healthcare access, climate, and housing in your community. 2. Educate and organize. Talk about what's happening in the classroom, in group chats, in community meetings, online. Keep on sharing. 3. Build political power. Support and develop leaders who center equity and justice. Push for reforms beyond the two-party status quo. And 4. Keep showing up. Join coalitions. Host teach-ins. Stay engaged with your state and local policy conversation. The bill may be law, but the fight for public health equity is far from over, and you are still a critical part of the solution. And one thing that I realized after I wrote this piece was that many of the proposed sanctions in this bill are going to take effect later on. Many of them are going to have impact after the midterm elections, which is a very strategic move by the GOP. Marketplace premiums could skyrocket by January 2026. Immigrant eligibility changes and SNAP course cut. Marketplace premiums could skyrocket by January 2026. Immigrant eligibility changes and SNAP cost sharing will start by October 2026. Medicaid work requirements won't impact enrollment until 2027, and some states may get extensions. There's a phase down of Medicaid provider taxes, and state directed payments won't happen until 2028. So I say this to say that there is time for us to come together, to coalesce, and to make our voices heard, that this is not what we want for our country, and this is not the direction we need to ensure that there's equitable health and better health for all Americans. In conclusion, the One Big Beautiful Bill is not beautiful, it's brutal. It put millions of people at risk. But we are public health, and we do not stand silent while injustice hides behind policy language. Let's name the harm. Let's organize. Let's fight like our health depends on it, because it does. A bill that ignores the humanity and the health of millions isn't bold or visionary. It's dangerous. I hope you all got some value from this. Be sure to hit that subscribe button if you have not as yet. Leave a like. Share this with someone who gets some value from it. And be sure that you continue to voice and have these conversations on how this policy change is going to have broad impacts in our communities. Thank you all, and let's continue to work together. Peace, everyone.